Welcome back. Pregnancy can be very challenging, and the pandemic has brought on new challenges for pregnant mothers. Late last week, Leanne talked with our team at Mercy Health to learn more about how they're helping women during this time. Take a listen.
This morning, we are joined by Dr. Jessica Gibby, an OBGYN with Mercy Health Physician Partners, to talk to us about women's health and maternity care through the pandemic. We want to welcome you to the show. Good morning to you, Dr. Gibby.
Good morning.
First of all, let's go ahead and talk to us about the benefits of women going to an OBGYN and then what services that you and your team provide.
Sure. Well, as most people know, an OBGYN is a particular physician who specializes in women's health. We wear really many hats. As an obstetrician, we're caring for women through the preconception period and helping them usher through their pregnancies with a unique medical and surgical skill set, and then through the postpartum period as well. And then as a gynecologist, we do both health maintenance and cancer prevention and screening, and then provide gynecologic services as well, which include many surgical skills that help with many benign gynecologic conditions. As far as our particular services for the obstetrical side, we manage pregnancies both complicated and uncomplicated. We have on-site ultrasound and lactation support and counseling. From the gynecologic piece, we manage abnormal pap smears. We do contraception care and counseling. We also have many surgical services to manage various benign gynecologic conditions and abnormal bleeding and pelvic pain, which include both laparoscopic procedures, which includes both traditional laparoscopy and the robotic surgery with the Da Vinci surgical system. We do endometrial ablations and manage pelvic floor conditions such as prolapse and incontinence. And then we also do a lot of menopausal care as well. So the list really goes on. We have a lot of skills.
And I think all that really hits on how the care for women changes as we age. So expand on that just a little bit if you don't mind.
It does. So, we have the unique opportunity to care for a woman throughout her lifetime. Oftentimes we're seeing a girl as she's in her late teens, early 20s. She's seeking information on contraception. She's interested in STD screening, and we're helping them understand what those needs are and give them counseling, and also start with pap smear screening at the age of 21. From there, they typically march into the reproductive years, and they can potentially start having benign gynecologic issues. We do a lot of health maintenance as well, and then we start managing their pregnancies. So we do some preconception counseling, and then are there to offer treatment options and counseling for any gynecologic concerns that come up. And then as they're done with their reproductive years, we help them through perimenopause and menopausal transition with both hormonal concerns as their body is changing, and also different conditions that occur with menopause.
And as we know, many women have had to deliver children throughout the pandemic. So what is Mercy Health doing to help support pregnant women through COVID?
Yeah, so we're really doing our best to keep that family-centered care focus for us while following the CDC guidelines. On the outpatient side, both physicians and staff are screened every single day. They're doing this on the inpatient side too, but just to keep it easy for the outpatient side first, you get screened at the door every day to make sure you're a healthy person coming in, to decrease risk and exposure. Everyone is wearing their masks and face shields appropriately. We are allowing as well one healthy visitor for each outpatient visit, so they have a support person throughout their visits if they care to have one. And then we're helping them be roomed quickly and efficiently as well, so they have less time sitting in the waiting room and that kind of thing. For the inpatient care, we have these wonderful newly renovated spacious rooms. For the patient and her partner, we have the ability to let them have 2 healthy visitors that are adults as well through their maternity care. Again, the staff are screened every single day, going through each patient as they come into the door as well, and they're admitted for labor, for example, or any gynecologic issue. They're screened for COVID as well. If for some reason they test positive, we do have rooms set aside for those patients, and they can still have a support person there. They're just a little bit more isolated, if that makes sense. And And then from the postpartum side, regardless of COVID status, we're having the baby room in and following all the appropriate guidelines so that I have good bonding and can start their family.
I think that's already put a lot of expectant moms at ease with everything you just said, but anything else as far as words of advice for new moms?
Well, I actually had the really unique opportunity to be both the patient and the physician throughout this pandemic. We welcomed our second son in May. So at the beginning of this pandemic, I was that pregnant patient trying to maneuver the healthcare system in an uncharted time. I think, we had a lot of questions and fears that came up, like what was the hospital stay going to be like this time? Could we have visitors? What's it going to be like after? How can we keep our son safe? Just a lot of fears with the unknown, obviously. What helped us is talking to each other, to my spouse in particular, talking to my family, and then more importantly, partnering with your physician and your care team and asking those questions. We're here really to answer any questions about the COVID virus through pregnancy, postpartum period, nursing, and also to answer questions about the vaccination as that's becoming more readily available as well too. And we have a really unique population that this can be useful for. Ultimately for us, it was a little bit of a quieter experience, but it was really a lot like the same. The only difference is that my partner and then my care team had masks on for most of the time. And our postpartum period, we didn't have any visitors just because it was a different time of the pandemic at that time. And we were discharged as soon as both my son and I were felt to be safe. And we're doing the same things for our patients as well, too. And yeah, he's 10 months now and really he's thriving and doing great. So.
Well, congratulations on your beautiful baby boy. And it sounds like you guys have all the precautions in place. Thank you so much for your time this morning.
No problem. Glad to be here.
Absolutely. To request an appointment with a Mercy Health OBGYN, please visit mercyhealthmaternitykare.com.